Namaskar. Lung cancer, which has the highest mortality rate in the world globally than any other cancer. According to WHO 2018 report, 2.9 million cases have been reported for the lung cancer. Today, as we observe Lung Cancer Awareness Week, I. Abhibroto, Research Fellow, Department of Biochemistry, AIIMS, New Delhi, is here to create awareness about the lung cancer. Broadly speaking, lung cancer is uncontrolled cell growth in the tissues of the lung. Every day, 6.9 new cases of lung cancers are registered in India. Globally, 2 million cases with 1.8 million deaths are recorded. You will be fascinated to know that Hungary had the highest rate of lung cancer till 2018. And if we see India, Mizoram stands to be reported with the highest cancer incident and comparatively in the mains dominated with the lung cancer. We can classify lung cancer into two broad categories: small cell carcinoma, non small cell carcinoma. If we see the prevalence of carcinoma, about 80 to 85% lung carcinoma are non-small cell carcinoma and 15% are small cell carcinoma. If we look at the symptoms which leads to this lung cancers, you can thoroughly see the patients which have a cough which doesn't go for 2 to 3 weeks. You need to check recurrent chest infection. We see sputum in the blood, there is a breathlessness issues and the persistent tiredness is observed. The only screening method which has been recorded or which has been guided by US is low dose CT chest x-ray. But in India, we have other methods which are not so effective but can be done is the chest x-ray, effective radiography and the sputum cytology. The main challenges faced in lung cancer is late diagnosis. The early detection can help patient and the treatment management. The issues come with the cancer care and the palliative management. The main cause of lung cancer, or you can say that 80% of lung cancer is due to smoking. As you have seen in my previous video, I have been dealing or discussing about the causes of smoking in India and which is leading to COPD and other cause of respiratory diseases. The factors which are playing an important role in lung cancer apart from smoking is radon exposure, asbestos exposure, pollution also seem to be one of the reason for that. So people residing in Delhi need to be more careful regarding as we are mostly suffering from the pollution, and my suggestion to the geriatric population should be not to go out during these days because your lungs are affected. Talking about the treatment, as we all aware of the various kinds of treatment done in the cancer, same includes for the lung cancer, which includes surgery, chemotherapy, radiation therapy, and the latest technology which is the immunotherapy. When it comes to the diagnosis, there has been, or you can say that the current research we are going in the field of lung cancer is DNA methylation can be proved as a better marker for the diagnosis of the lung cancer. There is a arrow-based technology which can help in predicting and prognosis the diagnosis. Microsatellite differences in 50% of the primary cell carcinoma can be useful. We need to understand the better biology of the lung cancer to identify and predict with the early diagnostic marker and improvement in the lung cancer. Main controversy in the field of research of lung cancer is how COPD and lung fibrosis contribute to cause this cancer development. There are a lot of cases coming where COPD is turning into lung cancer development. It's still a question of research. Now, the use of artificial intelligence, the newer technique. Artificial intelligence helps clinicians to accurate judgment and decision whether it is a benign or a malignant tumor. Evaluation of the lung nodule, histological differences and identification of gene helps the clinicians, and use of AI has been helping for targeted therapy in lung cancer. For any lung cancer patient, the management plays an important role. Broadly speaking, the first thing we look into pulmonary rehab program, which aims to improve the overall quality of life of a lung cancer patient. Exercise training, proper nutritional counseling. Patient as well as family should be educated regarding the strategies and management of a lung cancer patient. Managing the most important part is anxiety and depression, which plays an important role for a lung cancer patient. Finally, my message on Lung Cancer Awareness Week would be you should avoid smoking, avoid exposure to the chemicals. For the geriatric population and the person with comorbidities, I would suggest be as indoor as much as you can. Keep your lungs healthy, be safe, and avoid lung cancer.